Good afternoon, everyone. So, as so many students have told me to take a topic of prescription writing and posology, so we'll take first of all prescription writing. This is the chapter which come for 10 marks and not for 20 marks, mind it. Okay, so I told you there is question number 4 in which the must coming question like write down the originality and speciality of homeopathic pharmacy, and the second question is prescription writing. So prescription writing is the topic which will be asked for 10 marks, and must coming question is you have to prepare it properly. So prescription writing, first of all, what is prescription writing? So prescription writing is nothing but a written document which has been written by the physician. It is given the direction for the compounder. Okay, it is given, they have written the direction for the compounder to prepare medicine, and it has been written for the patient. Okay, the how to take medicine is given in the prescription writing. So first of all, what are the important points, what are the important things what you have to write for 10 marks in prescription writing? So first thing is its definition. You must know the definition of prescription writing. Then what are the part of prescription writing, and what are the characteristics of prescription writing? So first of all, we'll talk about characteristics of prescription writing, then we'll talk about the parts of prescription writing. So what are the characteristics? See, in characteristic you must know there are some points you must write in the characteristic of prescription writing. The first thing is you must know the form. What is the form? What is the norm? What is the legibility? And what is the accuracy of your prescription? The first thing is the norm of the prescription writing. Norm is nothing but the pattern. In which pattern, in which type, in which form you are writing the prescription writing. So norm is nothing but the pattern. Okay, now what is the pattern? So pattern is nothing but the, you must write a superscription first, then inscription, then subscription, and then last one is a signature. Are you getting? The first thing is the superscription, second one is the inscription, third one is the subscription, and fourth one is the signature. So this is the pattern in which you must write your prescription. So this comes under this comes under norm. This is the norm. This is the pattern. If you are writing subscription first, that is wrong. If you are writing signature first, wrong. You have to write superscription, inscription, subscription, and then last one is a signature. So this is the norm of writing a prescription. Then second one is the form. In which form you are writing your prescription? Form is nothing but the language, the style in which you are writing your prescription. If you are writing it in English, you have to write in a proper English, in a proper handwriting. It should be readable. Okay, and that is why the next thing is the accuracy of the prescription writing, legibility of prescription writing. If you are writing it in a Latin form, you have to write it in a Latin form only. If you are writing it in a normal English form, you have to write in a English form. So that is the form. Third one is the accuracy. Whatever prescription you are writing, it should be accurate one. If you are writing it in a proper direction, if you are writing it in a, for example, if you want to give medicine in the form of globule, you must write there the globular form, and you must write, if you are giving it in a water, if you are giving it in a directly dilution, that should be written in your prescription, so that the compounder will prepare the dose accordingly. If you want to give only one single dose, you should write that accurately. So that part comes under accuracy. And legibility, again, it should be readable. It should be readable. It should be in a normal state. It should be in a normal form, so that the compounder should able to read that properly, and should able to give that medicine or prepare that medicine properly, and should give the direction how to take medicine. Okay, as well as in the prescription. So this is all about the characteristic of prescription writing. The second important thing is the part of prescription writing. So part, as I have already told you, in the form only, how to write it in the norm and form. So that is the parts of prescription writing. What are the parts of prescription writing? The first one is the superscription, second one is the inscription, third one is the subscription, and the fourth one is the signature. So these all are the parts of prescription writing. Now what comes in the first part? What is that? Superscription. So what comes in superscription? The name of patient, the age, gender of patient, as well as the sign Rx should come in the superscription. Now why they are writing sign Rx over there? The reason behind it, it is the Lord Jupiter according to Greek mythology they are writing, and Rx means to receive. Okay, so two meanings are there, and that is why in superscription we must write four things. The number one is the name of patient, age of patient, gender of patient, as well as Rx. Okay, so this comes this is known as a superscription. Then second one is the after superscription, the second one is what? Second one is the inscription. The inscription is the most important part of prescription writing. Why inscription is the most important? Because in inscription only we are writing the name of medicine. What medicine we are going to give, that we are going to write in the inscription. So inscription is the second important part of the prescription writing, but this is the most important. This is known as the heart of prescription, because the main name of medicine we are writing here. See what we are writing in superscription. We are writing the name and address and everything about patient in superscription. In inscription, what we are writing? We are writing the name of medicine and how we are preparing that medicine, how we are giving that medicine. These all things, in which potency we are preparing, these all things are included in inscription. So inscription is the heart of prescription, or the body of prescription it is known as. The next thing is what? After inscription we are writing subscription. See, in subscription it includes the direction for the pharmacist. Okay, how to prepare medicine, how to dispense medicine, whether we are dispensing in directly dropper, whether we are dispensing it in a globular form, whether we are dispensing it in the biochemic tablet form, whether we are dispensing it in a saccharum lactose form, that all direction for pharmacist has been written in the subscription. And the last part is, which is known as a signature. So in signature, what are the things included? Obviously, the name of physician, address of physician, registration number of physician, and the sign of physician. So each and everything regarding physician has been included in the signature, the last part. Is it clear? Now the first thing what we have discussed about, the first thing is the definition of prescription writing. What is the definition? It is the written direction or written document by the physician to his own compounder or the pharmacist for the preparation of medicine, and it is for the patient about the mode of intake. So this is the definition of prescription writing. Now second thing what we have talked about, what are the principle or what are the characteristics of the prescription writing. So four things we have written there, we have told there. The first thing is the in which norm. Okay, that is the pattern. Second thing what we have talked about, form. In which form, whether you are writing it in a Latin form, whether that is a style of prescription, whether it is in Latin form, whether it is in Greek form, whether it is in bold form, whether it is in normal English form. So especially in India we are writing it is in a normal English form. Then next one is a legibility. Legibility means it should be easily readable. Okay, anybody should able to read. Obviously, we have seen other prescription, the physician are writing prescription which is not in a proper handwriting, but it should be in a proper handwriting according to the ideal prescription. I am telling you about the ideal prescription. So, ideal prescription should be, everybody should be able to read that. So, easily readable is nothing but a legibility of the prescription. And the last one is the accuracy and reliability of the ingredient. Whatever you are writing, it should be accurate one. So that is all about the principle or the characteristics of the prescription writing. Next thing, we have talked about different parts of prescription writing. So in part, I told you only 4 parts are there. So if you are writing all those things in a proper form, you will definitely get more than 9 marks. 8 or 9 marks. Okay, I told you they will never give you 10 marks, but more than 8 marks you can earn. So here if you are writing proper principal characteristic, proper definition, and then next one is the parts of prescription writing. In that I told you 4 parts: superscription, subscription, sorry, not subscription, superscription, inscription, subscription, and signature. So superscription include the name of patient, age of patient, gender of patient, symbol RX. Why we are writing name of patient, why we are writing age of patient, why we are writing address of patient, each and everything is most important thing. That is why we are writing. Why it is important? See, whenever you keep your prescription in your file, whenever the patient will come next time, you should able to identify, yes, this is the name of patient and we have given this prescription for this patient. Okay, so that is why each and everything in a superscription is very much important. Second thing is what, why we are writing age, because again, in this age, see, there are different age group. In this age group, these diseases are commonly seen. In some, say for example, in old age group, the wear and tear changes are there, and that is why in old age these diseases are common. So these all are the points, they are very much important. Why we are writing in prescription, these are the important things regarding patient, so that we should able to identify them when they are coming for the next follow-up. So next thing is the gender of patient, and last one is the symbol RX. Now what is the utility of RX, that also I have told you. The RX means to receive, and as well as it is the sign of God Lord Jupiter according to the Greek mythology, and all those words came from the Greek only. This prescription word also came from the Greek. It is a Greek word. So many English words are coming from Greek and Latin, as I have already told you that. So what is the meaning of that prescription, the word meaning or etymology? The para means before, and writing or scribo means writing. So prescription writing means before I write. Okay, so that is the etymology or the word meaning of prescription writing. So that is all about the part of prescription as well as norm of prescription, as well as the now next one is what, the inscription. And I told you inscription is the most important part of the prescription. Why it is the most important part? Because in inscription the name of medicine is there, the number of potency is there, as well as it is quantity, how much quantity you should give to your patient, how much repetition of the medicine should be done. So this all comes under inscription. Now what is subscription? I told you subscription is for the direction for the pharmacist, direction for the compounder, and the last one is the signature, the name of patient, physician in signature, the address of physician, as well as the signature of physician. And if you want to give some advice to your patient, that also you can write in the signature. So this is all things has been given in your textbook. You can prepare your own notes. So what are the important things you must write in 10 marks? Number 1, etymology. Okay, number 2, definition of prescription. Number 3, its characteristic or principle of prescription writing. Number 4, the parts of prescription writing. And number 5, you have to write an ideal prescription. It is given in your textbook. You can go through that, all the prescription they have written. You have to write only 2 examples. Okay, if you are writing this much, again one more important thing which is you must write in your prescription writing, that is the abbreviations. So there are some important abbreviation I will definitely write, and I will give it to you on WhatsApp only, and you just go through that all abbreviations which are commonly used. That abbreviation I will tell you, you read all each and every abbreviation, but go through in detail. Okay, whatever I am going to give you, that all are the important abbreviations. So I think that is more than sufficient for prescription writing. Go through your textbook, and if you are having still some doubt, just ask me. Thank you.